Good afternoon, everyone. So I cannot resist to say a big thank you to Helen and Success Charity team for connecting us here together today. I was invited to talk about our NIHR-funded project, which is aiming to overcome some challenges with access to neurorehabilitation through using virtual reality system unlike digital platform. So probably I will start with our virtual reality neurorehabilitation team that I like calling the fun team because we are aiming for the fun engagement. So next to me you can see Ivan Freland, who is our virtual reality expert, but he's also a research fellow at Sheffield University. Then some of you, if you are parents, might have met Daniel Bell, who is our neuro-oncology physiotherapist at Great Ormond Street Hospital. And I have no doubt that most of you remember Professor Darren Hartridge, who is also one of our colleagues, neuro-oncologists at GOSH. So we, our team at GOSH and UCL, are working with Ivan and his team at Sheffield on designing neurorehabilitation virtual reality system to help children and young adults recovering from brain injuries. A little bit about the system. So the system is based on the multiple award-winning Luna slide, which is a system aiming for rehabilitation of patients undergoing problems with orthopedic aspects or functional of various of their limbs and also ataxia as well. But the system, has been designed with help from patients, their parents, families, and also physiotherapists at Sheffield University and Sheffield's Children's Hospital. And this is an immersive virtual reality game where scenarios align with the exercises required for upper limb motor functional recovery. So exercises such as extension, flexion, and rotation. So here on this slide, you can see a young person who is trying archery using a virtual reality headset. On the right side, probably it's not very clear, but this is what he can see through the headset. So his hand, which is like navy blue, has turned into avatar's hand, and then you've got the bow used for the archery. So what is our aim? Our aim is not only to improve the access to neurorehabilitation, which everyone agrees currently depends a little bit on your postcode, local resources, but also personal family resources. But the other important aspect that previously the teams have mentioned is motivation of our children and young people. How can we motivate them to engage in physical activities leading to their improvement in of function? So we would like to do that by selecting age-appropriate intervention. So our project is NIHR funded, and it's divided into 3 stages. First stage we completed last year when during the workshops with brain tumor survivors, especially recruited from the Success Charity, we designed various games such as archery and climbing that offer children fun and innovative way of experiencing challenges with different levels and obstacles, but it means that these exercises feel like part of the story. So it helps us to motivate players and to ensure that they adhere with their treatment programs. And also children and young adults, when they are playing these games, they are actually undergoing neurorehabilitation in a fun and painless way, not realizing that this is neurorehabilitation. So depending on the age, we've got different games, whatever people like. Also, there are choices. One of my favorite ones is the Summer Slam, because this one is designed specifically for use while in bed to encourage upper body movements. So it encourages reaching outside the immediate area, both forward and to the side. And again, you can see white avatar's hand. So this is the patient's hand. And then we've got other selection. And again, very grateful to some of the Success Charity members, families who spend half of Saturday with us thinking about these games and how we can improve those to address the needs and also to make sure that these games serve their purpose. Now, the second stage will be usability trials. And within the next few months, we are aiming to recruit around 15 children and young people, and also their parents or guardians, who are either undergoing neurorehabilitation or have had experience with neurorehabilitation. We will be inviting participants to come either to Great Ormond Street Hospital or Institute of Childcare, which is next door. And we will be encouraging them to test the VR system, while we will be observing them from research perspective, but also from clinical perspective to ensure it's safe, but also ensure that the games serve the purpose. We will be collecting the data based on our observation and then some questionnaires and interviews with young people, children and their families. And this data will be again used to improve our games and to make sure that it serves the purpose and all our times and efforts. And then the next most important step will be clinical trial, which we are aiming initially to run between Great Ormond Street Hospital and Sheffield Children's Hospital. So I was given 5 minutes only, and I just want to say, just expecting that there will be more patients here, but or brain tumor survivors. But I appreciate that families are present. So if you are interested, or your children and young people are interested, want to have some fun one Saturday, please get in touch, come and talk to me, or alternatively, I'm very happy to be emailed on the email provided, and for the Success Charity team to share my contact details as well. Thank you so much.